Uncertainty tonight surrounding a controversial new plan to overhaul the state's health care system. This as the clock is ticking for state officials to submit their proposal to the feds on block grants. News Channel 5's Chris Conti is at the Capitol. And Chris, you're hearing a number of doctors are worried about this plan.
Rory, yesterday the Tennessee Medical Association said there aren't enough specifics in this plan to tell if it's even a good idea. Their concern is that statewide it would reduce TennCare funding, and therefore the state would end up having to purge some of our most vulnerable residents from this Medicaid program. Right now, there are about 1.5 million people who rely on TennCare for their health care coverage. It's Tennessee's version of Medicaid. This block grant proposal would mean the state just gets a giant chunk of change from the feds. It's going to be about $8 billion. But it's unclear if people would lose coverage, and there are concerns that that might not be enough money depending on how much people's coverage costs. We sat down today with Dr. Melinda Button from Vandy. Here's what she has asked the state to consider.
I would like to see some really concrete goals for this waiver. I would love to see TennCare say, we want to improve infant mortality or improve outcomes for children with asthma, or set some real goals and give some concrete things that they could do if they got this waiver proposal approved, or this waiver amendment approved.
Right now, there are no other states in the country that use a block grant program like this. Public commenting on this proposal ends tomorrow. We are live at the Capitol this evening. Chris Conti, News Channel 5.
Thank you, Chris.